Allo Ask the Sexpert was started with the intention of normalizing conversations around sexual wellness and sexual health. In the episode so far, we've talked about a lot of topics, but there's one thing we're yet to talk about: not wanting to have sex or having a different desire towards sex. Welcome, you're watching Allo Ask the Sexpert. I'm Artika, and today I'm going to be hosting another Sexpert to talk about an equally important topic related to sex. So let me welcome a psychiatrist with Allo Health and a sexual medicine expert, Dr. Karthik. Hello,
Thank
Dr.
you,
Karthik.
Artika. Nice to be back here again.
Yeah, it's always so great
with
seeing
another
you.
interesting topic, maybe.
Yeah, very interesting. I think we've been on repeat talking about sex and sexuality and sexual health concerns. One of the things which came to my notice and I thought we should talk about is having a different almost definition of desire that some people experience. And in that sense, saying that it's not maybe as high as that of other people's. So, I mean, what can we talk about with respect to low desire when it comes to sex?
So, when we talk about low desire, it is actually one of the most important problems in sexual health, because when we talk about sexual health, it goes down in 4 phases, okay? First is your desire, next is your erection, next is your ejaculation, next is your resolution. Now, it is designed in such a way that only if desire is normal, the subsequent 3 stages are normal. Only if arousal, erection is normal, only then the ejaculation will be normal. So if the desire at the initial phase only is gone wrong, then subsequently the person would not have a proper erection or an ejaculation or resolution. In simple terms, now you will be able to have proper sexual activity with a person only if you intend to do so. If the intent only is not there, then there is no point in going ahead with it. Okay, so this is mostly misdiagnosed. Like, let's say the person actually has reduced desire to perform with a partner, but then he comes down to us, presents to us with erectile dysfunction. He comes and tells me that I am unable to have a good enough erection or unable to sustain for a longer time. Only upon inquiring, we get to know that, his desire also is kind of less low. So then if you treat the desire as such, subsequently all the other phases would get rectified themselves.
Right. So basically saying that any kind of sexual activity will typically have 4 interlinked phases that follow each other in some sort of a chronological order. And I think one of the terms that you mentioned here was intent. That one of the leading factors for desire is intent. But as we have unfortunately seen in many cases of assault and sexual abuse, that the intent is not there, but the other phases do follow, and it's a big conversation and a debate that starts off, right? Like if somebody has been a victim of sexual assault or rape, and if they have come to an orgasm, then it's like, oh, were they enjoying the rape? It's a very controversial topic, but this has been heard in media, etc. So what I'm getting at is that, okay, apart from intent, are there other factors that lead up to desire?
I didn't get your question per se, but let's to put it in a scientific way, desire is a very complicated term, to be really frank. One, for you to have a normal desire, you should have a very good relationship with your partner as such. If there is no proper relationship apart from sex, I'm talking about, then you would not probably be having the desire. At the same time, your sex hormones also should be at normal levels. Let's say in simple terms, testosterone. Now, testosterone is a hormone which is majorly or a derivative of testosterone, what we call as dihydroepiandrosterone, is the one which is responsible majorly for desire. Both in men and in women, it's the same hormone. So, if the hormone itself is less, then it might lead to low desire. Okay, but again, when I say desire, it's not as a whole. Sometimes desire can be just partner specific. It could be less, like a person might not be getting the same desire with one particular partner, but he might be able to fantasize himself with others, or he might be able to have sexual activity with somebody else, interested there, but not specifically with one partner. Even that is an entity right now.
Yeah, no, I think that's exactly what I was wanting to know more about, the different factors. And for example, you mentioned hormonal factors as being one which are not at all related to intent. And that makes me also wonder that then in itself, is low desire a medical concern for which we can kind of map out the causes?
Yes, definitely. Okay, so first and foremost, what generally we think is sex hormones are so important that if sex hormone is less, then the desire is less. No, not really. Majority of the hypoactive sexual desire disorder, what we call it as, are majorly psychogenic in etiogenicy. What I mean to say is most of the factors here, why the person is not getting an intent with that particular partner is because of maybe their interpersonal relationships are, bad, or any of the other things. It could be, as well as a primary psychiatric disorder, like, a simple depression. One of the core feature of depression is that the person would not be willing, would not have that intent to perform sexual activity because he's not enjoying getting the pleasure anywhere. We have to come out of that misconception where reduced testosterone is the only reason. Maybe like a lot of other, like how we think, like we see a lot of people just taking testosterone injections for desire, all these things. But we need to know that God has given us more testosterone than what is actually necessary. So as per science, if we go only 5% of this HSDD, what we call hyperactive sexual desire disorder, only 5% of them are because of reduced testosterone.
Okay.
Rest, most of them are basically because of psychogenic factors.
Right. And just wondering, because, like you said, it can be a partner to partner difference. It could depend on a person's mood. It could depend on so many other psychogenic factors, like you put it. Then how do you identify that something that you're experiencing is low desire, or something that you actually need to seek help for, or it's just a passing phase?
Frankly speaking, for any of these things, it is always better to consult your therapist or a doctor as such, whatever it is. Even you will not be in a position to whether, judge whether it's a problem or not. Because you're having low desire, that means you need to work it out. So once you go to a doctor and speak, he will be able to differentiate. In simple terms, let's say, if the person comes and tells me that, I'm not being able to get that desire to perform with my wife. Now, reasons can be many. It could be as simple as anxiety. Like, it's like an exam where the person knows that if he goes, he'll fail. Okay, like this fellow is probably, like most common scenario what we come across is they come and tell that I'm unable to have sexual activity with my wife, so I don't feel like going on. It's like who will be interested in giving an exam where you're already going to flunk. So it's that way. So we have to work it out through that and probably take it forward from there and see. The most simple way to identify is if the person is masturbating. Let's say if he's masturbating, if he's able to fantasize other people and do it, that means it is not hyperactive sexual desire disorder because his desire is normal. It's only that he's unable to do it with that particular partner. So if masturbation, everything is fine, then biologically everything is fine. His desire is good, he's getting an action, everything. So it is high time you consult your therapist, work it out, just see what is the problem there and then solve it.
Take it from there. Right. And I'm just curious to know that if somebody does consult a therapist, like you said, if they realize they're in that space, they've identified and acknowledged it, all of which can be a little bit of a journey for people, especially when it comes to sexual health disorders, right? I feel like going to the doctor actually is the easier part of the journey because there is somebody who is scientifically there to support you. The tougher part is actually reaching there. But let's say if somebody reaches that space, I'm just curious to understand what this therapy session or this consultation looks like.
Now that you will have to actually talk to a proper psychologist for that. But then there are various techniques, like, there is something called as Masters and Johnson technique, all these things. They work from the basis, basically, where the problem arose. Was it earlier okay? Is it a primary concern? Was it the problem there from beginning, or was everything okay and now it is, they've developed this issue? Why did they develop? How to sort it out? All these things. But what I can say as a doctor is there are medications to improve your sexual desire.
Okay.
Starting maybe from your testosterone replacement, which might be necessary in some cases. To, there are certain drugs, let's say bupropion, pramipexole. So there are so many other drugs, and there are some natural sexual enhancers, desire enhancers, which you can try. Okay, they do help. But at the end of it, therapy forms the mainstay of treatment, and that is something more scientific, which needs a whole lot of time to discuss, and a therapist should be a better person for that actually.
So Dr. Karthik, low sex desire is not a very commonly talked about topic because I think there's still a lot of stigma around it and shame around even coming out and saying that you could be experiencing it. But we've still got some questions about it, and I would love to take the opportunity to have you answer these questions. This segment is, of course, called Ask Your Question. We take your questions and have an expert answer them. In case you have some question after watching this episode or any of our other episodes, you can drop them in the link in this description. So I think I'll just start from the first question itself. Okay. My wife feels like having sex much more than I do. How do we make this work?
Okay. So as I told you, desire is something very subjective. It depends from, it has its roots from childhood, basically. It depends from the way you're educated about sex, whether it has been stigmatized, which community you belong to, how do you talk about it, how open you're about it, all these things. Now, what we say is that at least in a married couple, at least once a month is something which is okay. Something very less than that, it requires help. Okay. Now, there can be certain discrepancies. One person might be wanting more, one person might be wanting less. The basic point here is if a person is like, really pathologically, there is very less desire, not even once a month, then it requires medical help. Otherwise, it's better you consult a therapist, try to work it out somewhere in between from point A to point B, somewhere in between. You have to compromise, and that is where the thing goes into. Okay, but then this is not something very simple where you can, okay, I can just end it by telling, no, you just do it, try to do it more, end of story. But that is not how it works. If you're not feeling like doing it, either if the wife is feeling too much, that is a problem, or if you're not feeling, if you're not at all feeling like having sex, then it is too less, then there is a problem on both sides. Somewhere you'll have to consult a therapist, work it out. That is how it
I think that was where we ended our last discussion as well, that therapy could be an answer to even figuring out what's happening, and then,
However, this is more odd because HSDD is more commonly found in women in India, actually. Now, various reasons again, as most common being pregnancy.
Okay.
Whenever a lady delivers a baby, it's nature's way of, telling it, have sex a bit less during that time, because whenever, you're breastfeeding the baby, a hormone called prolactin increases in the body.
Right.
That naturally inhibits your sexual desire. So if the wife is in the lactating period, naturally her desire would be low. But sometimes there are very, very rare instances where prolactin hormone naturally increases because of a small tumor, or because of certain drugs that you're taking. In most of psychiatry drugs, you give antipsychotics for some psychosis patients like schizophrenia or anything of that sort, or for mood disorders where you try to control the brain to an extent. Once that happens, because of those drugs also, prolactin might increase. Even that can lead to such issues. However, there are better drugs right now. If you are facing any of these issues, you consult a doctor. He or she can change the drugs, or there are a lot of other methods which can be used.
Right. Absolutely correct. I hope anybody who was listening in has been able to make a note of all of that information, because it could be really valuable in them figuring out what's happening with them. Just moving on to the next question. I've heard weight gain is linked with not wanting to have sex. Is that true?
Yes, definitely true. Because what happens is when there is obesity, when there is increased peripheral fat in the body, your male sex hormone is converted into female sex hormone. Now, the way I told you, whether in men or in women, testosterone is the major hormone which actually helps you get a desire. Now, if you're obese, your hormone, testosterone, is converted into a different hormone, estradiol, in your peripheral fat. Okay, when that happens, naturally your desire kind of goes down. Okay, so yes, obesity is definitely linked. So regular physical activity, as I suggested for any other sexual well-being, physical activity and keeping your weight under control is a must. However, if you still have some other issue which is linked to obesity, and there are again medicines to help you avoid all these things, so you can consult your doctor.
Yeah, definitely. I think obesity and weight gain also just being operative words, that a weight gain could lead to obesity, and a weight gain could in general be just weight gain as well, right?
Yes, it's basically a cycle.
Right.
Okay. So
a weight gain, if not controlled, could lead to obesity.
Yes. So you have to break it somewhere.
Right.
So exercise is the most preferable way.
Yeah, absolutely. The last question for the day is low sexual desire equal to being asexual, i.e. never wanting sex?
It's a different spectrum. Maybe the highest order of hypoactive sexual desire disorder would be asexuality. But in hypoactive sexual desire disorder, at least the patient realizes that he has a problem. He has reduced desire. So he comes to you for treatment. Asexual is a term where you're not attracted to anything at all. You don't have an object to which you're sexually attracted. Okay. So asexuality is probably the extreme form, if you ask me. Okay. It's more complicated.
Right. And rather a form of sexuality, like a low sexual desire could mean that there are
low
still
sexual
moments
desire,
of
yes,
sexual
is
desire.
a problem, is a diagnosis. Asexuality is something related to your whole sexuality as such,
Right,
where you
right.
don't feel like doing it at all.
Right. I think, but the confusion is quite common, I feel, because of similar definitions, and I'm sure this is something that worries a lot of people.
In simple
as
terms,
well.
asexual person is very happy without having sex also. He doesn't need.
Not a concern.
HSDD, the patient actually, is finding it bothersome. He's unable
Right,
to find the
right.
desire to have it.
Right. Right. That was the end of our questions. I was just looking to see if there were more, but that was the end of our questions. So thank you again for sharing your time with us. Again, if you all have any questions, you can drop them in the link below. I'm pretty sure we're going to have Dr. Karthik back, so you can hear all of those answers from him. Until then, it's Dr. Karthik and Artika signing off. We'll see you again with another episode and another exciting topic. Okay, take care and bye.